Hi, I am Kila. On this occasion, I will talk about 5 common signs of dengue fever that you should know. Knowing the early 5 common signs of dengue fever can help you receive the best treatment before it becomes serious or even life-threatening. So let's get started with a closer look at what dengue fever is first. Dengue fever is rare in the United States, but around 100 cases are reported each year. Most cases in the United States occur in people who contracted the infection while traveling abroad. The Centers for Disease Control and Prevention, CDC, estimate that 400 million people are infected each year. The Aedes aegypti mosquito is the primary vector of dengue. The virus is transmitted to humans through the bites of infected female mosquitoes. The mosquito becomes infected when it bites a person with dengue virus in their blood. So it can't be spread directly from one person to another person. After virus incubation for 4 to 10 days, an infected mosquito is capable of transmitting the virus for the rest of its life. Most people recover within a week or so. In some cases, symptoms worsen and can become life-threatening. Blood vessels often become damaged and leaky. And the number of clot-forming cells, platelets, in your bloodstream drops. This can cause a severe form of dengue fever, called dengue hemorrhagic fever. Many people, especially children, may experience no signs or symptoms during a mild case of dengue fever. When symptoms do occur, they usually begin 4 to 7 days after you are bitten by an infected mosquito. Dengue should be suspected when a high fever is about 38 degrees Celsius or 104 degrees Fahrenheit and is accompanied by 2 or 3 of the following signs. And here are 5 common signs of dengue fever. 1. Sudden onset of high fever. One of the most common signs of dengue fever is sudden onset of high fever. A fever, also known as pyrexia, is, to put it simply, a higher than normal body temperature. Fever is usually the body's response to an infection such as the flu, cold virus, bacterial infection, or by an inflammation that occurs with tissue injury or disease. When you become infected with a viral condition, your body's first line of defense in a fever. This natural mechanism increases your body's temperature in an attempt to kill the bacteria causing your condition. It's happened when the body's immune response is triggered by pyrogens, fever-producing substances. In most cases, a fever is nothing to worry about. But typically, the body should hover around 38 degrees Celsius. It should be noted that it is incredibly rare that the onset of a fever will be a standalone symptom. It should also be known that the presence of a fever can also lead to symptoms that may or may not be present in the absence of a fever. However, if your temperature is found to be at 103 degrees Fahrenheit, 39.4 degrees Celsius, or higher, then it is time to go see a doctor. If you develop an acute fever, your fever lasts for more than 3 days, you should seek medical assistance as soon as possible to keep your body temperature under a healthy limit. 2. Severe joint and muscle pain. The second common sign of dengue fever is severe joint and muscle pain. Pain is the foremost symptom of dengue fever. Severe pain is felt all through the body. But pain in joints, muscles, headache, pain behind the eyes is extremely high. In dengue, myalgia or muscle pain is prominent. When the body is fighting off an infection, much of its finite amount of resources is being used for the battle in hand, and thus, a different part of the body might suffer as a result. Called infectious arthritis, this term is used to describe any and all joint pain, soreness, stiffness and swelling caused by an infectious agent such as bacteria and viruses. In the case of dengue fever, it falls into the middle category. Knowing as we do that this joint pain is the result of an infection, it only stands to reason that when the virus enters the bloodstream, it can easily move to another part of the body, and thus could cause further pain and discomfort. Many patients develop pain across the body after becoming infected. The pain can be felt throughout different parts of the body, including the muscle, joints, and bones. Pain also can range from severe to mild and may be constant or intermittent. Pain occurs because the virus affects the basic structure of the body's muscles, causing pain to occur. If you have a strong immune system, you are less likely to feel pain. Even after a cure, pain can persist for a while. Talk to your doctor about options for pain relief. Also, stay hydrated to reduce pain in a natural way. 3. Severe headache, mostly in the forehead. The third common sign of dengue fever is severe headache. Getting a headache is just one of the many symptoms that dengue fever patients have to deal with. Along with fever, headaches are among the most common symptoms associated with illness. Headaches can be very frustrating, and they don't go away easily. However, it is important to understand that not all headaches are the same, much like their root causes can vary significantly. Primary headaches are caused by overactivity of or problems with that pain-sensitive structures in your head. This type of a headache is not the result of an underlying disease. Secondary headaches, on the other hand, is a symptom of a disease that can activate the pain-sensitive nerves of the head. Possible causes for this include acute sinusitis, brain tumor, concussion, dehydration, ear infection, and also dengue fever. Many sufferers of dengue fever liken their severe headaches as being directly linked and influenced by other symptoms, either providing relief or adding additional discomfort. For more immediate relief, try laying down after drinking a few glasses of water. Besides a headache, you can also expect to feel pain behind the eyes, which worsens with eye movement. Typically, when people think of illness and disease, a pain behind the eyes isn't the first symptom that comes to mind. In fact, most people at some point or another has had sore eyes. Usually, any pain and discomfort will go away on its own. However, in some instances, prolonged and severe discomfort can be the sign of a more serious underlying issue. Optic neuritis is an inflammation of the nerve that travels from the back of the eyeball into your brain. Multiple sclerosis and other conditions or infections such as dengue fever are often to blame. People with dengue fever often report a severe, almost stabbing-like pain behind their eyes. This feeling is further compounded by looking side to side or just general movement. Anytime that you are experiencing eye pain, especially if it involves a loss of vision, headache or myoclonic pain, you should see your physician immediately. 4. Swollen glands. Another common sign of dengue fever is swollen glands. For those of you who might not be familiar with the term swollen glands, it simply refers to enlarged lymph nodes. As a matter of fact, your lymph nodes are not actually glands at all. What they are is small bundles of white blood cells that are present in various places throughout your body. According to Harvard Health publications, one of the ways the body's immune system responds to infections and inflammation is to greatly increase the number of white cells in the lymph nodes, causing them to swell. Most often, swollen lymph nodes are caused by an infection or some other benign condition. In the case of dengue fever, your lymph nodes are working overtime, producing countless white blood cells to ward off the infection. As a result, they can get swollen, often visibly and tender to the touch. 5. Lethargy. The last common sign of dengue fever is lethargy. As I mentioned in the previous point, our body only has a finite amount of energy. On a typical day, we are able to use that energy as we wish, physically, mentally or emotionally. However, when your body is fighting off an infection, that finite amount of energy gets used up, and sadly, you won't find yourself with much say in the matter. The result of this uneven distribution of the body's resources results in a feeling of being tired, even after a proper amount of rest, as well as a lack of overall motivation. However, it should be noted that while lethargy can certainly be symptoms of an underlying issue, it is possible that the issue on the whole, by that I mean the effects of the other symptoms, fever, joint and muscle pain, headache, are all unpleasant symptoms and can not only take their toll on the body, but dealing with them for prolonged periods can also have an impact on your psyche. The result is a feeling of constantly being tired, regardless of how well rested you think you are. Lethargy also can cause loss of your appetite. When you become infected with the common flu, you often notice your appetite decreasing. The same applies to patients who suffer from dengue fever. Their appetite often diminishes because their bodies use all their energy for fighting the disease. Make sure to drink plenty of water if you become infected, as dehydration can significantly increase the severeness of other symptoms. Whenever you can, try to eat stale bread to get some energy. Over time, try consuming more complex foods. If you notice the presence of this sign coupled with other on this list, you might want to visit your healthcare professional. Are you worried that you or someone you know may have dengue fever? Having some of the signs of dengue fever doesn't mean you definitely have the condition. But you should always talk to your doctor when there's something wrong happen in your body that you never experienced it before, just to make sure and to find out the causes. The earlier you can identify you're having dengue fever, the better your chances to get the best treatment. Thank you for watching 5 common signs of dengue fever. Early detection could save your life longer. Subscribe for more videos every week. Hope you feel better.